It is a great honor for me to be here for the 2025 Annual Surgical Scientific Conference and also the third edition of the Surgical Landscape Exhibition. Allow me to congratulate you for 3 years in a row organizing the surgical exhibition and the conference. You have been working on having effective systems that work all over the country. It is not easy, but I want to appreciate the fact that you have visited regions, you have managed to attend to patients, you have reduced the backlog. It keeps on growing. Even when you reduce, it's like a drop in the ocean.
We want to advance the science of surgery. We want to meet and share and inspire and also reflect on our challenges and learn from each other.
One of you good surgeons here in this house gave me the mass, and he described it. 56-year-old man with anorectal mass, parectal bleeding for 2 years, pain and weight loss. That is a description of cancer. And he gives me a rectal mass. By examination, even you can see that that is a normal tissue. He said, please check again. And that is the essence of my talk today. Please, you talk to your pathologist, ask him to check again before you get agitated and withdraw the block.
We need to increase funding, we need to improve infrastructure, we need to undertake personnel development. And when you train people, you need to be able to absorb these people, you need to compensate them.
Saying I want to expand our partnerships with Uganda, particularly in the area of breast cancer. I would love to have our next fellow come from Uganda and then come back to Uganda and lead breast cancer efforts.
Let us mentor those who are from behind, and let us look for mentors who are going to hold our hands for us to be able to go further. Finding resources to build the capacity and sustain a successful surgical training program is both a domestic and a global affair. Both can be able to work, and as we continue to expand our networks, let us ensure that not just Uganda, but indeed the whole continent of Africa will build and succeed in increasing the local passion for global surgery.
As training institutions, what is our promise to the sector and to the population? Do we promise them a general surgeon? Do we promise them 10 general surgeons and 5 orthopedic and 6 neuro? What is the promise?
So let's be inclusive, and then, like I said, the advocacy message should be targeted and customized. How we are going to advocate to the Minister of Health is not the same way we are going to advocate to the patient.
A picture like that is not uncommon in your practice, where you find a woman who has had several surgeries, several complications, just because people have gone into a frozen pelvis and couldn't do much. So we want to avoid this kind of picture. The first surgery should be the last surgery and should be the best surgery.
As Parliament, we have established the Uganda Heart Institute and Uganda Cancer Institute under Acts of Parliament to give them the advantages that come with full autonomy to funding these areas, including the money needed for the Organ Transplant Council in order to save lives and prevent referrals abroad.
I want to encourage you to continue and also to pledge that we shall work together to find better ways and resources to facilitate you to continue, because you are doing work for the nation.
Production by Davy Cinematography.